Morning all. We might as well try and get underway, even though I'm about 10 minutes late, which means I have 10 minutes fewer things to say than I had to say, which was very little. Anyway, Minister, fellow board members, distinguished speakers, ladies and gentlemen, welcome to Smock Alley and the National HIV Conference 2017. I'm Byrne, Condon. I'm the chairperson of HIV Ireland. And it is my great pleasure to welcome you here to this conference. When any organisation reaches 30, it's appropriate that it might reflect on itself, reflect why it's here, where it's come from, what it's doing now, and where it's going to. And I think that was probably the theme and the rationale behind why we decided, having hit 30, to have a conference. And I think those three ingredients, where we've come from, which is so poignantly reflected in the quilt, of which we'll hear a presentation later, but it is a really poignant and moving example of where we come from, and where we're going to hear also from Tony Walsh and others about what was a tragic and awful history over many years and cannot be forgotten. And as we said in our annual report, the organisation this year, it's not a matter of celebration that you're still here after 30 years. It's a matter of marking it, commemorating it, and committing yourself to continuing to advocate for the services for people who live with HIV, to continue to provide for testing, and we're very grateful that Know Now is back up and running and under our auspices, and that we engage in attempting to walk with the people who have lost, the people who were brave enough to stand up over that period of time and provide care and comfort, and for those who want to now take on the challenge of fighting stigma, preparing for a generation of people living with HIV as they age, and dealing with what is a continuing crisis in the numbers of people being diagnosed. When we launched our PrEP paper some months ago, Dr. Paddy Mallon, well known to you, I suspect all, who is a consultant at the Mater Hospital, referred to it as a crisis. And when you have a crisis, you have to have an extraordinary response to a crisis. And we in our organisation are committed to attempting to be part of that response, both in terms of advocating strongly for the introduction of, for example, PrEP medication, advocating strongly for challenging stigma, and advocating for the services for people in the community who require it. So we'll continue to do that. We're here 30 years. Perhaps we don't want to have to be here for 30 years, but we are, and we're committing ourselves to continuing to do that. Now, on the more prosaic front, can I take the opportunity, even at this stage, because a conference like this doesn't just happen, to thank, obviously, Niall and the group who put together the conference. I do want to recognise that these things don't fly on air, and that we're grateful to the assistance of GSK, of Gilead, and of Dublin City Council for putting this together. There's a Twitter handle for those of you who want to tweet, so this is one of the occasions when we don't say switch off your phones, leave on your phones, just get a good picture of me. Otherwise, the Twitter handle is #HIV2017, and our Twitter handle, if you want it, is @HIV_Ireland. I have no idea why we still have an underscore. Niall might tell me why we didn't get the HIV Ireland one, but anyway, that's who we are. There's a lot of people who have a lot of expertise who know more about this than I do, and I think it will be very beneficial to listen to them, so it's better that I let them tell you firsthand what they have to say. Also, I'm very grateful to the Minister for being here. It's an important acknowledgement of the issues and of the importance of the work that we do, and of the importance of 30 years, as I say again, reflected on the walls of this building, And thank you indeed, Minister, and I would now invite you to open our conference, Minister Catherine Byrne. Thank you.
Okay. Can you hear me? You can, yeah. Oh, okay, good morning to you all. I'm delighted to be here, and I'm delighted to be in this beautiful place, which was a church, and I actually believe my mum was baptised here at some stage in her life. So I just something remembered when I was coming in, talking about the church here. First of all, I'm delighted to be here. Thank you, Brendan, and thank you, Niall. The invitation this morning to be part of your conference and to open the conference to me has been a real, I suppose, special event for me this morning. I've lived and worked in a community where addiction, where drugs, where alcohol, and where the fact that young people and older people who have contracted HIV have been seen in the past as being really not individuals and not human beings in many ways. Let me say at the outset that the subject matter of this conference is significant. Sometimes it seems that HIV is one of the most stigmatic conditions of our times. As a result of the plight of people living with the diagnosis and the burden that it adds to them, not only to themselves, but their families and to the communities that they live in. I recognise that people living with HIV face many challenges about judgment, rejection, hurt, even desperation. The effects with their quality of life and the challenges for people living with a diagnosis can't be underestimated. The stigma can be a barrier talking about HIV, but yet when we create a safe space to talk about HIV, we protect everyone. When reading the summary of the report, I was struck by the fact that 61% not diagnosed because of fear and how they would be judged. And right through the summary, the word came up, trust. And I was really struck by the fact that every avenue that was talked about during the summary and in most of the material I read was about having confidence and trust in people and people being able to share their thoughts. All of us have a common goal here today. We want to work to take away the stigma about HIV, and that is why this conference to me is so important, and there should be many of them. The result for both HIV Ireland, Knowledge and Attitude Survey, and its People Living with HIV Stigma Survey contain real good data that is captured how people live their lives and are viewed within Irish society, and how HIV impacts on everyday lives and their experiences. One of the key findings, which is reflected in the title of the conference, is that the continuing stigma of HIV-related and misunderstanding of the illness itself in our society. The common myth that came across in the survey was that HIV can be contracted, keep on saying that word wrong, 70% by bites and 9% if you sit on a toilet seat. And I was really taken back by the fact, reading that how little we know and how society in general understand about HIV. Let us not miss the opportunity for those involved in HIV, sexual health and other health-related work in the network to share and to acknowledge all of our efforts in dealing with this. I was struck about 30 years ago, probably less than 30 years ago, when the whole stigma of AIDS was around. And a very young girl, Princess Diane, went into a hospital and shook hands with a man who was dying from AIDS at the time. And straight away, overnight, the stigma of AIDS was lifted among communities. And I think for this very small gesture of taking somebody's hand and wishing them well, put a huge significance on how people should be treated in society who have an illness of any kind. Let us use the strong partnerships and sense of common purpose that exists between all of the statutory and voluntary organisations to work together. It is only through working together we can achieve anything. And I said in a conference the other day down in Limerick The power of one person can make such a difference in everybody's lives. And just like Princess Diana done on that morning when she visited that hospice, when she took the hand of this man and held it, showed to the world that one person can make that huge difference. We are continuing to implement our national sexual health strategy in this context. The strategy itself is set about within Healthy Ireland, the national framework for actions to improve health and well-being of all the country and of all our future generations and present. I want to emphasise once again the close working relationship and engagement of the voluntary and community groups with the HSE Sexual Health Crisis Pregnancy Programme and the National Clinical Director. These good working relationships have been central to implementing the strategy that we have now, and I cannot overstate this point enough. The implementation of the strategies is in all our interest. The strategy was developed based on 3 goals. Everyone in Ireland will receive comprehensive and age-appropriate sexual health education information and will have access to appropriate prevention and promotion services. Accessibility and high-quality sexual health services which are targeted and tailored to the needs of those who need it to everyone be made available. And a robust and high-quality sexual information will be gendered to underpin policies, practice, service planning and strategic monitoring. The strategy recognises the diversity of sexual identities. It supports all experience of sexual identities through positive sexual health and well-being outcomes. The National Sexual Health Strategy has been developed against a backdrop of change in Ireland regarding sexual behaviour and sexuality in Ireland's decades. The change in landscape is evidenced in legislation introduced in recent years, and more openness generally in attitudes and cultures around sexuality and sexual health issues. However, there are still many challenges out there, as all of you know, who work in this area and live in communities and work in voluntary groups. And we have to work together, as I've already said, to be that one voice that will change the identity of people living with HIV in this country. Further progress is necessary to overcome the fear of stigma, discrimination, which may prevent people accessing the medical assistance and counselling support they need, especially given the consequences of non-disclosure of late diagnosis of sexually transmitted infections. The fear, the rejection and the stigma still plays a huge part in people coming forward who have contracted HIV. All of us are deeply concerned of the rise of HIV and other STIs. Provisional data from the Health Promotion Surveillance Centre indicates there have been 365 cases of HIV infection so far this year. There was 512 newly recorded HIV cases in Ireland last year. As the previous speaker has said, this is very worrying for all of us. We must continue to work on the ground, in our communities, in our voluntary groups and across every sector, to tell young people and to tell older people it's not a crime to have HIV. The recent increase in HIV, particularly among men who have sex with men, are a real case of concern. We're aware that the late diagnosis of HIV continues to be a huge problem. This is one of the reasons why funding was provided to pilot a peer-led point-of-care rapid HIV testing initiative in pubs and clubs as part of the National Sexual Health Strategy. The reality is that a diagnosis of HIV for a person has a long-term impact on their lives, not only on them as an individual, but as I've already said, on their partners, on their family, and on their community. We must strive to reinforce HIV education, awareness, testing and treatment. It is undeniable that there are all-important aspects of dealing with the challenges of HIV. We all have a role to play, and that role can only be played as together we work together. Being yourself, being who you are, being who you want to be, is the most important in all of our lives. To be identified as who I am and to be loved for who I am. Sadly today, many young people still struggle with their sexuality, but I have to believe this, when I visit schools, that many teachers now and principals and schools themselves have really begun to turn the clock on how young people are treated in the classroom because of their sexuality. And I think that's something that we have to be very proud of in this country. We have one of the youngest populations in Europe with young people. I think we need to do everything we can to give all of those who are struggling with whether it's addiction, whether identifying who they are, the opportunities that they need in life to stand up, to be strong, and to be self-confident. I just want to refer to the work of HIV Ireland. This was originally the Dublin AIDS Alliance. From the past 3 decades, HIV Ireland has worked tirelessly to contribute towards a significant reduction in the incidence and prevalence of HIV in Ireland. It's worked towards the realisation of AIDS-free generation. An Ireland with a significant reduction in the case of HIV, reduced new HIV infections and HIV-related stigmas and discrimination. This is important work in an area with many challenges. Through the 80s and the 90s, HIV was prevalent in Ireland. When it first spread, there was very little public knowledge about the virus and social fears around its significance. There was a sense of being alone for those diagnosed with this, and this is what became the stigma. HIV Ireland has set up with a vision to contribute to the reduction in HIV here and to eradicate HIV-related stigma. 30 years on, the landscape has changed significantly. Once diagnosed and receiving treatment, people can now live a long and healthy life and fulfilling life as well. The work of HIV Ireland has undoubtedly saved lives and improved the quality of lives for so many people living with HIV in this state. Last year alone, HIV Ireland supported more than 2,000 initiatives for those living with HIV, those ranging from providing counselling, meditation, to provide human rights information and support. I'm conscious of the fact 30 years on, even though it's not a wedding anniversary, it is a pearl anniversary, can I say. And the pearl of wisdom and knowledge is the gift that you have given to many people out there through your organisation. And I want to wish you every continuing success. But most of all, what you've given is a compassion and trust, an acknowledgement that everyone matters and that people care for each other in this country. The work of HIV Ireland over the last 30 years emphasised particularly service positions. Services are provided under 2 pillars: community support and prevention, education and training. I want to acknowledge here today the work of those 3 decades and of the many volunteers and the HIV activists of HIV Ireland. The work and effort has been very important for dealing and responding to the challenges of the HIV virus and many people directly or indirectly affected by it. I met Mary earlier on. I know Mary's gone, I didn't get her second name. Mary and the quilt, I'll identify her as Mary and the quilt. And she explained to me about the quilts hanging on the wall and the identification of those people whose lives have been, I suppose, put into a tapestry, which will hang in different places. I see she's at the back of the hall down there, she's hiding. And one of the things she said to me when we had our short conversation was, the quilt was about remembering those who have passed on, our loved ones, and giving hope to those who are into the future. And I think that's what the quilts have said to me as well. There is hope that I'm reading there is hope into 51 people who live with HIV feel more open-minded and are recognised by the compassion as a result of that stigma that's caused on their lives. I recognise that we must all work together to promote and understand HIV, to remove the stigma around it. And in many ways, HIV is a hidden illness. It is a marginalised condition, a manageable condition thanks to medical advancements. But to its aspects, the data collected from both surveys provide an opportunity to measure where Irish society, with respect to its knowledge and its attitude to HIV, we must take note of this and use it in our response to the many challenges that we still face ahead to prevent HIV virus. I want to thank you for all the work you've done on the ground, and in my new role as Minister for State for promoting our Healthy Ireland and the National Drug Strategy. I'm often taken when I'm asked to come and speak at these occasions that people in the seats know a lot more than I do. I think but we share one common value and goal, and my common value and goal is that people should live a life, a full life, a life that's healthy, a life with no stigma, and a life where compassion and hope and individuality is the most important anything any one of us can have as individuals living in our wonderful country. Thank you very much this morning for listening to me.
Thank you, Minister, for those inspiring words. A good way to start the morning, but now on to the first session, and our chairperson of the first session is Joan Byrne from Citywide. So Joan, take it away. Thank you.